Welcome to the NP POW Videocast, a space where I will talk to nurse practitioner experts who are going to kindly share their pearls of wisdom, or what we call NP POWs, on an array of healthcare topics. I am your host, Dr. Julia Rogers, a certified nurse practitioner, and today we are very honored to have Dr. Bernadette Melnyk, a nurse practitioner and Chief Wellness Officer, to discuss health, wellness, and the emerging role of Chief Wellness Officer. Thanks for joining us today, Dr. Melnyk.
I'm delighted to be with you, Julia.
Well, first, I just want to get a little background, and I want you to tell us a little bit about yourself, your passions, and your role as a nurse practitioner and your Chief Wellness Officer role.
Well, I grew up in a small little coal mining town in southwestern Pennsylvania. My dad was a coal miner. I lived in half of the company house. It was probably 900 square feet. We struggled financially, but I was born with rose-colored glasses on, and I still can make lemonade out of lemons still yet today. But my whole world shattered when I was 15, home alone with my mother when she sneezed, stroked out, and died right in front of me. You can imagine how traumatic that was for a teenager. I suffered with terrible post-traumatic stress disorder, anxiety, depression for months. After not doing well in school, not really eating much, being a mess, I was taken to my family physician, and my relatives said, please do something to help Bern. And actually, Julia, that provider did what so many do today. Got out a prescription pad, wrote a script for Valium, said, give Bern one of these every night. She'll sleep and be just fine. Well, I did take one that night, and I slept for the first time in months. But I woke up kind of groggy. I said, I don't like how this feels. I just got to gut it up and cope. But within the next 4 years, not only did I lose my mom suddenly, I lost a cousin who was like a brother to me after a car accident. I lost the only grandparent I ever knew and loved. And when I was 19, my dad had his heart attack. That's a lot of grief for a teenager. But you know the story. What doesn't break us truly makes us stronger. And as a result of what I experienced as a teenager, I became passionate to become a nurse, then a pediatric nurse practitioner, a psych mental health NP, and go on and get my PhD so I could develop my evidence-based COPE programs to help children and teens that are suffering with depression and anxiety all throughout the country. Those programs are being reimbursed now in primary care, which makes my heart so happy.
Well, we have a lot in common. I lost both of my parents as a teenager too, and I know back then, really, that's what they did. They just kept writing prescriptions instead of really sitting us down and talking to us even about our feelings. No one wanted to know that part. So I'm so glad that you are here today as a nurse, and that's the journey that you kind of took to become a nurse.
You
So,
know,
oh, sorry.
the saddest part of my mom's story, Julia, she had a history of headaches year. And my dad kept saying, would you go to the doctor and figure out what's wrong? She went to our family physician just 1 week before she died. Her diagnosis, high blood pressure, given a prescription for a blood pressure medication that my dad found in the purse after she died. She never took it. But think about this: 60% of Americans have a chronic condition, yet 80% of chronic disease is totally preventable with just a couple healthy lifestyle behaviors. We've got to shift our current healthcare system that is steeped in crisis and sick care to one wellness and prevention.
I agree. And I think, part of the problem, and I don't know if you'll agree with me, but part of the problem is all of these expectations that you need to see someone and treat them within 15 minutes or 10 minutes in some cases. And I don't even think that's long enough for you to kind of comprehend what is actually happening with that person.
You're so right. Again, we live, whether we like it or not, in a cost driven healthcare system. But you realize we only put 3% of our healthcare spending into wellness and prevention. It's no wonder our population health outcomes in the United States are near the bottom of Western world countries. We've got to shift the paradigm. You know, I was thinking about growing up in my small little town of Republic, Pennsylvania, when John F. Kennedy was president, when I was a little girl. Only 6% of Americans had a chronic disease. Flash forward to 60% now. And so much of that is behavior. You know, the number one cause of death in the country technically is still heart disease. But if you take into consideration all causes of death and disease in this country, it's our behaviors.
Mhm.
Physical inactivity, unhealthy eating, smoking, alcohol abuse. It's all of those things, but behavior change is so what I call character building. Most people don't change unless crisis happens or their emotions are raised.
Well, and I do also think that because you only have 10 minutes maybe to talk to someone about their health. Part of the issue also is that you tell them everything, right? It's almost like word vomit. I need you to quit smoking, quit drinking. I need you to exercise 3 times a week. I need you. And so that becomes overwhelming. And then they feel like I can't do anything. And so I also think we also have to change the mindset that if you change one thing, one small thing today, and do that for a month, then maybe you can change something else and keep building on that instead of saying do all of this at once, because even I feel a little overwhelmed, when my provider tells me that. So I think it's a shift in all of it in how we are as people, patients, and how we are as providers as well.
I couldn't agree with you more. It takes 30 to 66 days of daily practice to make a behavior change. And what happens with so many people, January 1, I'm going to go from 10 minutes of physical activity twice a week to 35 days a week
Yes.
with what's recommended. They shoot so high, they fall off the wagon quick instead of setting a more realistic little stretch goal, because inch by inch, it's a cinch. Yard by yard, it's hard.
I love that saying. I think we should all have that on our right in front of our computers every day.
Exactly. So, to get back to my story, Julia, about how I became a chief wellness officer, and I want to share this because there's a lot of UNPs out there. You've got really big dreams, but maybe you're afraid to take a risk. And I am here to tell you, you got to keep dreaming big and taking risks. And then you got to persist through the character builders until your dreams come to fruition. I was dean of the College of Nursing and Health Innovation at Arizona State University when I get a call out of the blue one day from the chair of the search committee for the dean's position, Ohio State. And Carol said, Bern, we've seen how you've exploded the college there in Arizona. We want you to come to Buckeye Nation and do the same thing here. I had been studying corporate wellness for about 3 years. Big corporations got employee well-being. They had been hiring chief health officers, chief wellness officers to improve their population's health and well-being. So I thought to myself, I wonder how many universities have a chief wellness officer. I searched, I could find none. That was my next big dream. Go to a big public university as the first chief wellness officer in the country. I pitched that dream. I said, Carol, I'm really not going to make a lateral move. I'm not going to leave sunny Arizona and go to Columbus, Ohio. However, if there were an opportunity to combine the dean's job with a university-wide leadership role as a chief wellness officer, I might talk to you all. And I am not kidding you. The next day, our former president, E. Gordon Gee, calls me, and here's exactly the conversation. Bernadette Melnyk, this is V. Gordon Gee, the president of the Ohio State University. What the Sam Hill is the chief wellness officer, and what would you do for Ohio State value added if I created this role for you? That's exactly how I got to Ohio State. So I was the first in the country. Now I'm in a network of about 100 CWOs. But Julia, do you know what's really sad for me? They're almost all physicians, except a couple of us. And why the Sam Hill have we let medicine get ahead of us in this movement in wellness and prevention? I don't understand that to this day, because back to Florence Nightingale, she was all about wellness and prevention.
And I do think that nurses in general have been the guiders of wellness, and yet we're still allowing, right, the physicians to kind of take over those big roles. I'm just wondering, how did the complementary leadership positions of the chief wellness officer and the dean of the College of Nursing allow you to transform wellness initiatives, not only in the College of Nursing, but across the Ohio State University?
Yeah, because we're really big elephant, right? We have
Hmm.
66,000 students and about 44,000 faculty, staff, clinicians. My role as CWO, get everybody healthier, happy, and engaged, really. The combined role at first worked out well because it positioned me with other deans and leaders across the university. And I think that was key. But within 5 years, because I didn't have like an expert to call and
Hmm.
say, what do you suggest I do to start this?
Yeah.
I had to create the structure for wellness, the framework for wellness, our first strategic plan on health and well-being. But after about 5 years, both of those positions became full-time jobs.
Hmm.
So I was quite overextended doing both jobs. And when my contract was coming up again, I had been in both roles for almost 12 years. I'm like, I really need to focus on the CWO
Yes.
job and get a bit more work life harmony back in my
Hmm.
life because I was working
Taking
two
your own
full.
advice, right?
Exactly. So the best time to pass a leadership torch is in a position of strength. And I felt like I was just so happy with what we did for the college when I was there. I mean, we went from 1,100 students to 2,400 students. Our rankings came up to the top 5, the top 10, both in US News and World Report and NIH funding. And I built well building on the Ohio State campus for nursing, which was great. And
Hmm.
we raised the funds to have it totally paid. So that's when you want to step aside as a leader in a position of strength, not in a position of weakness or when a unit is not doing well. So that was my next goal, to establish that CWO office and position outside of the deanship. And now I've done that, which I'm
Yeah.
really excited about.
And I know that you should be really proud of the work that you did as both. I think it's hard to juggle both. As the first chief wellness officer in an academic setting, how do you feel like that role has evolved since you began? And what do you see as the most critical responsibilities of that position now that that's your full-time position?
Yeah, you know, you can have, Julia, the best menu of evidence based programs for your people, which we do at Ohio State. But you've got to do two other things. One, you got to fix system issues that we know cause burnout, depression, anxiety. My job, part of my job is to bring these system issues to leadership and say, these things need to be fixed. Thirdly, you got to build a culture of well being that makes it easy for people to engage in healthy lifestyle behaviors. All of my research, because I've done so much research in this whole burnout and well being space, but all of my research shows if people perceive they live and work in a culture that supports their well being, They have much less burnout, much less depression, and they're more engaged, which is great. But culture change is what I call character building. It doesn't happen overnight. And we're living now in an era where leaders in healthcare, deans across the country, the average length of time in their positions is about 3 years. That's not enough for culture change. And I'm so pleased that at Ohio State, we have focused so big on alignment, on culture change. It truly is in our DNA now, which is great.
Yes. Well, and that's a great transition to the next part of this interview, which is you are a big leader of evidence-based practice and implementing that evidence-based practice. So I'm just wondering, can you share some of the most successful evidence-based wellness interventions that you've implemented and what exactly made them particularly effective?
We got to remember, we have joked about the research practice time gap for since 2000, since the famous Bayless and Bourne paper was published that said it takes 17 years to translate evidence-based intervention and practice. And Kahn and colleagues in 2021 did another study. They updated that gap. They said now it only takes 15 years.
That's
I
crazy.
just, yes, I just chuckled because I said, oh my gosh, in 2 decades, we moved the needle 2 years. So at that pace, it'll only take us 150 more years to translate evidence from research in the practice to improve quality and safety of healthcare.
Mhm.
That's the definition of insanity. But,
Yes.
I've consulted, I still do keynotes on evidence based practice and wellness all throughout the nation and globe. And I will tell you, there are still so many organizations that function. That's the way we do it here.
Mhm.
That's the way Dr. So and so should say, says it needs to be done.
Mhm.
So we've got to bring up our students, our NPs, to be assertive, to
Mhm.
know how to contribute to that culture change, to know, have the skills in EBP. We have competencies that we have developed and published for evidence based practice. We've done national studies on this topic. And I'm sad to say we still have so much opportunity because the majority of clinicians, including nurses, are not steeped. EBP is not in their DNA.
Mhm. Well, and besides that, do you have any other information about how we can bridge that gap between research evidence and then using it in practical situations in real life? What is the answer to that to bridge that gap?
It's being competent in the skills, but it's culture. It gets back to culture again. Culture eats strategy for breakfast, lunch, and dinner. And if you are in a culture where evidence based practice is not put into practice consistently, so many people fall backwards into that trap again. And I think you bring up a really good point, Julia. When you're working in primary care and you're expected to see people in 10 minutes because you got to get that money in the door, that's a huge pressure. And it's a huge barrier to
Mhm.
reducing burnout. In all of my evidence-based practice research, there are two big drivers of whether people practice that consistently. One is culture. The second is mentorship in EBP. In my ARC, evidence-based practice model, we work on skilling up a critical mass of EBP mentors. Whether you work in a smaller practice or in a big healthcare system, mentorship for evidence-based practice is key for competency, for implementation, for healthcare quality and safety.
Well, and that leads us to overall just provider wellness. What are the unique wellness challenges that are facing nurse practitioners as well as other healthcare providers today? And how can healthcare organizations, including our academic settings, better support overall well-being?
Yeah. For one, here's what makes me sad, because I'm talking to NPs today. My research shows nurses, including APNs, do not themselves practice the evidence-based recommendations that we have for physical activity, healthy eating, sleeping 7 hours a night, and stress reduction. It has got to start with us. If we are not walking the talk, what's the likelihood our patients are going to follow our advice? But you know what? Nurse practitioners and nurses don't prioritize, a lot of them, their own self-care. They take great care of everybody else, but they don't practice good self-care. Self-care is not a nicety. It's a necessity. Because if we don't take good self-care, we can't take great care of others. We can't keep pouring from an empty cup, and we can't put it off. The earlier we start with these healthy behaviors, the less chronic disease we'll have. If we don't take the time for this now, we will have to take the time for chronic disease later. Work sites gotta build the culture to make it easy for people to engage. They have to fix system issues, like if it takes 12 clicks in the electronic health record to give a flu shot, that's a problem.
Yes.
It takes time away from the joy of caring for our people. So it's a very complex situation, but you got to start somewhere. And for those NPs who are listening today, please find your why. Face your true story right now. For instance, have you worked overtime instead of spent time with your family in the past month? Have you slept less than 7 hours a night? Have you gotten fast food because you didn't have the time to cook over the last week or two? But we've got to first face our true story. It is a strength to recognize our true story, or when we need help. It's not a weakness. And there's still this stigma, Julia, out there. We did, and I don't know if you saw one of my latest publications. So many nursing licensing boards across the United States, in fact, 37 states, are still asking inappropriate mental health questions on APRN and RN licensure applications. This is a barrier for people not seeking help because they're scared they're not going to get licensed again, they're going to lose their job. People have killed themselves. Nurses have a higher rate of suicide than the entire general population. We've got to do something about our mental health now. We can't wait. We got to put a sense of urgency on this.
I appreciate you bringing that up so much. I literally just had a doctoral student graduate, and her evidence-based practice project was on nurse suicide. And I honestly was dumbfounded by the numbers. Like you said, it has the highest rate of suicide, and I must have had my blinders on because I didn't realize, but I completely understand why, for all of the reasons that you just mentioned. We never take care of ourselves first because we're always taking care of others. So thank you so much for bringing that up.
2 years ago, I received a nice grant from the American Foundation for Suicide Prevention. I'm in the middle of a clinical trial to prevent nurse suicide. What we've done is we have digitalized my cognitive behavior therapy-based program that reduces depression, anxiety, suicidal thinking in children, teens, young adults. We have digitalized an adapted version of that for nurses and clinicians. We are testing it in a big national study in partnership with the American Nurses Association. We have sadly enrolled over 400 nurses across the United States who are at high risk for suicide. We have 2 arms in the study. One arm just gets the screen, the ISP screen by the American Foundation for Suicide Prevention. The other arm gets that, plus my digitalized cognitive behavior therapy-based program. We're following these nurses for a year after the intervention to see if we can get better outcomes with the addition of CBT, which we know is gold standard evidence-based treatment for depression and anxiety.
How we can have more interaction with people that actually need it for their mental health. I'm just wondering, as far as technology goes, how can we leverage that effectively in order to support wellness initiatives and still maintain that human connection?
You're onto something. So we're just finishing, we're writing the paper now. We've digitalized my CBT program for college age young adults. We just tested a 3-arm clinical trial. Students got it all self-delivered with technology, right? Digital. The second group got it self-delivered, but they had a facilitator that touched base with them periodically through the 7-week program. The last group got it delivered one-on-one by a nurse practitioner student. Bottom line, which of the interventions worked best? One-on-one delivery with a person. Second, self-delivered with a facilitator that at least personally touched base a few times with the students. But the digital still worked. We got drops in depression, anxiety, stress, with all digital delivery. But again, stronger dose impact when a person was either delivering it or touching base periodically.
Based on your extensive experience, what do you see as the future of health promotion and wellness and mental health in healthcare settings?
I think, and this is key, if we are going to advance, if we're going to get our healthcare system, our government, to invest more in wellness and prevention, we've got to show them the return on investment and value of investment. Without that data, and again, we take, of course, me being CWO for Ohio State, we take an evidence-based quality improvement approach to population health and well-being. We are diligent with measuring key outcomes, using that data then to target interventions where they're most needed. But you got to show the ROI and the value of investment to get your leadership to invest in well-being, to increase the resources for well-being. And that's where a lot of people fall short. They don't calculate return on investment or value of investment.
Because it comes full circle, as you said earlier, the bottom line is always the dollar, right? How that can kind of come back to the organization, company, or what you're doing to improve all of that. In your last few minutes, can you please share one or two POWs or pearls of wisdom to our nurse practitioner listeners that they can use in the new year that you have found the most helpful or beneficial in health and wellness?
It's the 3Ds, the ability to dream big, because nothing happens without a dream. After the pandemic, we have been in a state of what I call inertia. People need to put their dreams on the front burner again, get excited again about those dreams, support each other in achieving them. Never listen to negatoids around you that tell you how something can't happen. You got to turn those people, you got to become deaf to negatoids and negativity, and keep your dreams bigger than your fears and your uncertainties. The second D, it's all about discover. That's about risk taking. The most successful people in life have been the biggest dreamers and the biggest risk takers. Most people don't regret what they did in their life as they're coming to the end. They regret what they didn't do. And then lastly, the third D, deliver those dreams by persisting through the character builders, because you're going to have them. But again, keep your dreams bigger than your fears, and don't put self-care low on your priority list. You got to bump it up again, and you got to tell yourself your true story, and then get motivated to make a change. When I get up in the morning, I may not feel like exercising, taking my 2 character building pugs on a walk, but I put my loved ones in front of me. I didn't have a mother to see me graduate from high school, college, go on and have my 3 beautiful daughters. When I don't feel like exercising or eating healthy, I put my loved ones' faces in front of me. And if I don't do it for myself, I do it for them because they want me to be around a long time.
You make me want to just get up and go walk my 2 miles today. So thank you. Thank you so much for that pearl of wisdom. Do you have any other pearls of wisdom to share?
I do. I have an evidence-based pearl of wisdom, and that is vitamin G for gratitude. Gratitude is one of the simplest evidence-based practices that if we put it into our daily lives, we'll have more optimism, better moods, better heart health. So I encourage all of you, take and give a dose of vitamin G starting today and see how much better you feel. Lastly, I want to encourage you to take my 155 eye opener challenge. That is, when you wake up in the morning, practice 1 minute of gratitude. 2, read 5 minutes in a positive book or listen 5 minutes to a positive podcast. 3, 5 minutes of movement, stretching. Just remember to move more and sit less throughout your day for renewed energy. You are worth 11 minutes a day.
I agree. And I learned something from you when I heard you at a conference, which is it's okay to get up from your seat while you're listening to someone and just walk to the back of the room so that you're not sitting for that hour or 2 hours. So we can all learn something by just moving. I have gained so much from you today, Dr. Melnyk, on health and wellness and about even mental health. And I appreciate you and all you have done to truly make our lives and our patients' lives better through health promotion.
Thanks. It's been great to be with you. Keep dreaming, discovering, and delivering.
And I also want to thank all of our viewers and hope that you come back to hear more pearls of wisdom from our NP experts in the future. Until then, this is Julia Rogers wishing you joy today and every day.